My name is Ashley Zorns. I'm a student at Winston-Salem State University, and I conducted a professional interview of a healthcare worker. I chose to interview Jennifer Wilson. She is a certified registered nurse anesthetist. She works for regional anesthesia. They travel all over the East Coast to different hospitals and provide anesthesia for patients of all ages. Let's see. The first question I asked her was, how long did she have to go to school? She went to the University of Chapel Hill for her master's in nursing. Then she was an ICU nurse for I think she said she was an ICU nurse for over a year. Then she decided to go to CRNA school. Altogether, she said she was in school approximately 5 years. I asked her if she worked independently as a CRNA, and she said that she works under the direct supervision of an anesthesiologist. She does give the drugs to the patients, but the anesthesiologist has to be in the room when she is intubating a patient. The anesthesiologist is responsible for supervising up to 5 CRNAs and 5 ORs. So they go in and out of the rooms just to check on the patients and basically supervise the care that the CRNAs are getting. I asked her what types of medications she gives to patients to get them to sleep. First, she said that they give them fentanyl and Versed to kind of get them relaxed. And then they administer succinylcholine, rocuronium, or vecuronium to paralyze them from moving during the surgery. For pediatric patients, they place a mask over their face to give them sevoflurane, which is a gas that makes them fall asleep. At that point, they then get an IV and they get the drugs, fentanyl, and all that good stuff. I asked her, how does she wake patients up from surgery? If the patient is not getting any paralytics, which sometimes happens, all she has to do is turn off the gases and propofol, which propofol is a sedative medication that puts them to sleep too. Then they wake up. If they do receive paralytics, they have to receive a reversal agent. Usually it's called Sugamidex, which is the drug that reverses the paralytic. I asked her what are some complications that she has seen with administering anesthesia. She has seen drug allergies, anywhere from a rash to anaphylaxis, which means that airway closes up, bad things happen. Also, a big one in anesthesia is malignant hyperthermia. She stated that she's only seen that a couple of times in her career, but is extremely dangerous. And then bronchospasms is basically where the smooth muscle in the throat close up, and at that point they have to receive like albuterol to open up the airway. Interviewing Jennifer was enlightening for me. I've worked in surgery centers, so I kind of know a little bit about anesthesia, but listening to her tell me about it a little bit more opened my eyes to things I didn't know at first. She was really willing to sit down and kind of give me insight on what she does, and I didn't realize exactly how much they actually do and how long it took to go to school for this. But I'm very thankful that Jennifer sat down with me to do this interview. Thank you.